Parents nationwide are wondering how the H1N1 virus might affect the upcoming school year, which is getting here very soon. The CDC estimates there have been more than 1 million cases in the U.S. and more than 300 deaths. Our medical correspondent, Dr. Jennifer Ashton, is here with more on what we need to know. Good morning.
Good morning, Maggie. The H1N1 virus has already made it a rough summer for many campers. So what does this mean for the upcoming school year? At summer camps across the country, hundreds of kids have been sent home in recent weeks with flu-like symptoms.
We know it has spread through summer camps, and it's likely to present itself when schools reopen.
In California, H1N1 virus outbreaks have been reported at 16 camps in 8 counties. In Missouri, 250 campers were sent home after some came down with flu-like symptoms, and nearly 100 workers also became ill. State and local health officials, along with educators, will be looking at the experience in summer camps for guidance as they make plans for dealing with the virus. Some are taking a wait-and-see approach.
If the virus does not increase in severity, we are unlikely to recommend widespread or prolonged school closures.
In LA County, where schools remain in session through the summer, officials aren't waiting for the second wave to hit.
We're going to prepare for all types of scenarios.
This summer, Dr. Kimberly Ueda sent parents this letter reminding them of prevention tips and symptoms.
We just continue to say the educational messages about really trying to make parents and communities responsible for keeping kids home when they're ill and making sure that they practice a healthy habit.
Many schools and states are still preparing their H1N1 emergency plans, and even the CDC has yet to publish a final guidance for schools. But with schools right around the corner, that could make some parents a little nervous, Maggie.
Jen, at my daughter's school, there were no cases, but all of us moms know someone who had it, and in every single case it was mild. So a lot of us are starting to sort of relax and say, it was a mild flu. Do we really need to worry about the upcoming school year?
That's absolutely correct, Maggie. We do need to remember it's been mild. However, there's a fine line between panic and preparedness, and the death rate or the risk of dying is about 1 in 1,000, which is the same as the seasonal flu. If you're that one person, then it's appropriate to be taking this seriously.
And every single parent wants to know, and you and I have been talking about it this week, should or shouldn't I give my child the vaccine? Because some people remember back in the 70s, the last swine flu vaccine was very controversial.
That's right. And that decision is an individual one, Maggie, and it really should be respected up to the individual. However, it's risk versus benefit analysis. You have to take into account the risk of the vaccine, which while low, can never be said to be zero, and the benefits to get it, and discuss that with your doctor.
Do you think that most pediatricians would say, get the vaccine for your child?
I think they will, and they're going to take their lead from the CDC, Maggie.
All right, Dr. Jennifer Ashton, thank you.
You bet.